Have you noticed small changes in a loved one, perhaps a parent, an uncle, or an elderly partner, that at first seemed insignificant, but over time have become a source of concern? It's something I've often observed in my medical practice, after more than 20 years of experience in the field of aging medicine and men's health. Many people believe that death in old age happens suddenly. In reality, the human body tends to send signals well in advance. Sometimes months before, other times even a year before, life reaches its conclusion. Unfortunately, these signs often go unnoticed because they initially appear to be simple signs of aging. Today, I want to talk to you about 5 key and very common signals that frequently appear in the final year of life. Noticing and recognizing them can help you better understand your loved one's condition, act in time, and, most importantly, ensure that their final months are filled with dignity, comfort, and peace. The first sign I want to discuss is significant and unintentional weight loss. At first, it may seem like a small detail, a belt that suddenly needs tightening, clothes that fit more loosely, or a reduced appetite. But when this weight loss happens without any conscious effort and continues over time, it's often a sign of something much deeper happening inside. In the aging body, the ability to absorb nutrients diminishes. Muscle mass begins to decrease more rapidly than usual, and internal systems start to slow down. This degeneration goes far beyond normal aging. The body struggles to process protein, which leads to muscle atrophy. This not only makes movement more difficult, but also exposes the person to much more serious risks: falls, infections, and a gradually weakening immune system. Another important aspect of weight loss is a change in appetite. Food no longer tastes the same, the sense of hunger fades, and eating becomes more of a duty than a pleasure. In many cases, people begin skipping meals, eating less, or choosing only very simple, low-nutrient foods. It's a quiet process, but a very meaningful one. And it's not only tied to the digestive system. It may also be linked to more serious conditions like cancer, heart failure, kidney disease, or cognitive disorders. Depression also plays an important role. If someone loses interest in food, it may be a sign they are also struggling with a deeper emotional burden. When a family tries to solve the problem by offering favorite dishes or high-calorie drinks, but the weight continues to drop, it's a clear sign that it's no longer just about food. It's the body slowly beginning to shut down its vital functions. In these situations, it's more helpful to shift the focus from quantity to quality when it comes to nutrition. Simple foods that are easy to chew, constant hydration, and small, frequent meals can do much more than trying to force someone to eat. If you notice significant weight loss in an elderly person, don't ignore it. It's a message the body is sending you. Understanding it now allows you to prepare, to be close to them, and to ensure that every moment is lived with awareness and respect. Another sign I frequently encounter in my work with older adults is a deep, persistent fatigue that doesn't improve with rest. I'm not talking about the usual tiredness after a busy day or a restless night. This is a much deeper form of exhaustion, a kind of fatigue that's felt in every movement, every action, every thought. At this stage, even the simple act of getting out of bed can feel like climbing a mountain. Walking from one room to another becomes exhausting. Daily activities like getting dressed, preparing a meal, or even having a short conversation start to feel impossible. Some people begin to need help with even the most basic tasks, which can be deeply frustrating for those who have always been independent. This isn't just the tiredness that comes with aging. This kind of fatigue signals that the body is reducing the energy it allocates to secondary activities and focusing it solely on keeping vital functions going. The heart, for example, no longer pumps as efficiently as it once did. Circulation slows down, and the muscles receive less oxygen. As a result, the body adapts. It conserves, it saves, it slows down. In many cases, this leads to increased daytime sleep, with longer and more frequent naps. Some people may even seem suddenly exhausted right after appearing relatively energetic. This inconsistency can be confusing and may lead family members to believe there's still a lot of strength left, when in reality, it's only brief flashes of clarity and vitality. There's also a less obvious but equally important aspect: the emotional impact of fatigue. Many older adults feel embarrassed, frustrated, or sad that they can no longer do what once felt normal to them. This often leads to social withdrawal, avoiding conversations, neglecting hobbies, and slowly retreating into themselves. The result is a vicious cycle. Physical weakness leads to emotional isolation, which in turn worsens fatigue and accelerates overall decline. For caregivers, this can be hard to accept. It's easy to assume that the person is simply giving up, or that they just need a little more willpower. But that's not the case. At this stage, forcing activity doesn't help. What truly makes a difference is understanding their limits, respecting them, and offering support without expectations. Simply being present, listening, holding a hand, can have a powerful impact. If you notice that a loved one shows fatigue that doesn't go away with rest, take it as a serious sign. The body is going through an important transformation, and your role may be to bring comfort, calm, and closeness, rather than trying to push them into action. One of the most difficult signs for families to face is the growing mental confusion that can appear in the months leading up to the end of life. I'm talking about those cognitive changes that slowly transform the way a person thinks, remembers, orients themselves, and communicates. Even someone who has never had memory issues might begin to forget names, get lost in familiar places, or ask the same question multiple times within minutes. These changes are not just simple absent-mindedness. They are signs of a brain that is starting to slow down, often due to reduced oxygen, weaker circulation, or impaired metabolism. When blood flow to the brain decreases, its functions begin to deteriorate. The result can be a combination of confusion, disorientation, difficulty making decisions, trouble following conversations, and in more severe cases, failure to recognize familiar faces. Sometimes these episodes alternate with moments of clarity, which makes everything even harder to interpret. It's as if the person were shifting between two states, constantly moving back and forth between the present and the past, between reality and confusion. Alongside cognitive confusion, emotional withdrawal often occurs. The person who, just months ago, was talkative, engaged, and present, slowly begins to shut down. Not because they no longer care about the people around them, but because interacting becomes too exhausting. Conversations seem long and hard to follow, noisy environments feel overwhelming, and every stimulus is experienced as too much. You might notice that your loved one isolates themselves, avoids gatherings, and prefers to sit silently for hours, seemingly lost in thought. Sometimes there's a change in mood. Someone who used to be calm may become more anxious, someone who was energetic may grow apathetic, and someone who was always positive may begin to show irritability or indifference. This is not a change in personality. It's a direct consequence of the decline in brain function. Emotions become harder to express, and even reacting to simple stimuli becomes a challenge. This phase is especially difficult for family members. Seeing a loved one drift away emotionally, while still physically present, creates a quiet but intense pain. It feels as if they're already leaving, little by little. What I can advise you is this: don't try to force a return to normality. Instead, try to meet the person where they are. Speak gently, even if they don't always respond. Tell them something beautiful, play music, hold their hand. Even if they seem distant, your presence can still be felt, and the comfort you can offer with a simple gesture is more powerful than you might imagine. If your loved one seems more forgetful, confused, or uninterested in social life, don't underestimate these signs. They could be the way their body and mind are preparing for the final phase of life. Create a calm, protected space, free from pressure. Even when words fade, love can still be felt, and that's what truly matters. Among the signs that indicate an elderly person may be approaching the final stage of life, one stands out clearly. The body no longer heals the way it used to. Even a simple infection or a small cut can become a persistent issue. This happens because the immune system weakens, making it harder to fight off viruses, bacteria, or even repair minor skin damage. Someone who rarely got sick until recently might now frequently catch colds, flu, bronchitis, or urinary tract infections. Sometimes even skin infections or oral infections occur. These aren't isolated incidents. When they happen repeatedly or take longer and longer to heal, it's often a sign that the body no longer has the resources to fight back. One commonly overlooked factor is how the body's response to infection changes. Instead of high fever or a strong cough, as we might expect in a younger person, infections in the elderly often show up with more subtle symptoms: a sudden increase in fatigue, more confusion, a loss of appetite, or simply a general sense of feeling unwell. That's why many infections are recognized too late or not treated adequately. Wound healing also slows down. Small scratches, pressure sores, or bruises that don't go away, these can all point to impaired circulation. If blood doesn't reach the tissues effectively, oxygen and nutrients can't do their job. The result is wounds that stay open, become easily infected, and, if neglected, can become serious. In these situations, families often wonder whether to push for aggressive treatments like strong antibiotics, hospital admissions, IVs, or other medical interventions. But the truth is that, at this stage, the body may no longer respond to treatments the way it used to. Antibiotics lose effectiveness, therapies take longer, and they come at a great physical cost, often without delivering meaningful results. I'm not saying we should give up, but at a certain point, the goal shifts. It's no longer about curing at all costs, but about comfort. Making sure the person stays hydrated, keeping their skin clean and protected, and providing a peaceful, well-supported environment can be far more effective than yet another round of medication. The message I always try to convey is this: not everything that can be treated should be treated at all costs. Sometimes it's more humane to accept that the body is following its natural course, and that what we can do is make that journey as dignified and peaceful as possible. If the person you love gets sick often, struggles to heal, or shows signs of a weakened immune system, take it as a clear signal. It's time to pay attention not just to the illness, but to the person as a whole. What makes them feel good? What brings them relief? What do they truly need? The answer won't always be medicine. Sometimes it will simply be presence, a gentle touch, a kind gesture. As the body nears its final stage, one of the most obvious and often most distressing signs for those observing is a change in breathing. It's a symptom that leaves little doubt. Breathing becomes slower, shallower, more irregular. In some cases, your loved one may begin to breathe with what's known as Cheney-Stokes respiration, a pattern in which deep, rapid breaths alternate with sudden, silent pauses. At first, these episodes may be brief and sporadic, but over time they become more frequent and pronounced. It's the body's way of signaling that it's conserving energy, that the respiratory system is struggling to maintain its usual rhythm. Another very common sign is poor circulation. Hands, feet, nose, and ears become cold to the touch, often taking on a bluish or purplish tint. In some cases, the skin may appear mottled, especially in the extremities. This happens because the increasingly strained heart redirects blood flow to the vital organs, leaving fewer resources for the limbs. All of this can be very hard to witness. A person who once could get out of bed, walk, or speak with ease may now find themselves breathless just from changing position. Breathing becomes a tiring effort. Some begin breathing through their mouth, pausing frequently, or stopping mid-sentence. It's not uncommon for them to start sleeping in a semi-upright position, perhaps with several pillows behind their back or in a reclining chair. This helps them breathe more comfortably by reducing the feeling of pressure in the chest. It's a clear indication that the lungs are losing efficiency, and in some cases, fluid buildup can cause coughing, gurgling sounds, or shortness of breath. For caregivers, these moments are filled with anxiety. The urge to intervene immediately is strong, raising your voice, shaking them gently, calling for help. But very often, these changes do not point to a sudden medical emergency, but rather to a natural physiological transition. There is nothing to fix, but much that can be made more comfortable. So what can we do? A great deal. Keep the environment cool, quiet, and well ventilated. Use a humidifier to help with breathing. Offer small sips of water, or simply adjust their head and upper body with care. In some cases, specific medications or oxygen therapy may provide relief. But even then, the main goal remains the same: to ease their discomfort. If you notice these changes, breathing difficulties, cold extremities, or altered skin color, know that the body is making its final adjustments. This is the time to be present, to offer reassurance, and to ensure that the person you love feels safe, calm, and cared for. In these final weeks, sometimes days, what matters most is not another medication. It's a look that brings peace, a word that reassures, a silence that embraces. Now that we've gone through these 5 signs together, weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation, it's important to take a moment and reflect on what they truly mean. These signs are not exact predictions or diagnoses. They don't all appear at once, and they don't follow a set order. Every person is different. However, when they begin to add up, when you see them repeating or worsening over time, it's a clear message. The body is preparing for its final transition. Often, the natural reaction of those around is to resist, to fight, to look for solutions. We try to convince our loved one to eat more, to go for a walk, to hang in there. It's a human instinct driven by love and the desire to protect. But at this stage, what's needed is no longer the fight, it's acceptance. Acceptance means recognizing reality without fear. It means creating a space where your loved one feels heard, accompanied, and not left alone. It's a precious time when there's still so much to share. Memories, gentle touches, silences that speak louder than words. My advice as a doctor, but also as a human being who has walked this path with many families, is not to wait too long to shift your perspective. When you recognize these signs, don't think that all is lost. Instead, understand that you are entering a different phase, one where you can still bring great value to life, even if that life is nearing its end. During this time, you can help to ease physical suffering with small daily acts of care, reassure the mind with simple, sincere words, bring peace to the heart with your presence, which often says more than any speech. You don't need to be strong. You need to be present. Even just listening, staying quiet, or accompanying someone with a gentle gaze is a form of care, a deep form of care that is never forgotten. The most beautiful and meaningful moments I've witnessed in all my years of work haven't happened in intensive care units, but at home, with dignity, with family close by, with one hand held in another, with music filling the room, with a child retelling the story of when they were young. So I invite you not to waste the time you have left with your loved ones chasing impossible solutions. Use this time to truly be there, to say I love you, to listen to what has never been said, to forgive, to let go, to stay. If you've recognized one or more of these signs in someone you care about, know that you are not alone. Many families are walking the same path, carrying the same weight of emotions, doubts, and fears. And even if I can't be physically by your side, know that I'm here to offer you my experience, my voice, my guidance. What matters in the end is not how much we can do to avoid the inevitable, but how we can turn that time into something real and full of meaning. Thank you for following me this far. If this message has been helpful to you, I invite you to share it with someone who might need it. Sometimes a word at the right moment can change the way we experience the most delicate part of life. With respect and humanity, Dr. Balsano, specialist in aging medicine and men's health, supporting families for over 20 years. If you found this video helpful, please leave a like and subscribe to the channel. Share your thoughts in the comments. We'd love to hear what you think. Have a great day.